I'm going to read out the communique of IGAD Heads of State declaration on the coronavirus COVID-19 pandemic. 31st of March 2020, Preamble. We, the heads of state and government of Intergovernmental Authority on Development, IGAD, convening via video conference the extraordinary summit on coronavirus disease, COVID-19 pandemic, on the 31st of March 2020. 1. Deeply concerned by coronavirus COVID-19 pandemic, which constitutes an unprecedented global health crisis affecting a large part of the world. 2. Taking note of the increasing levels of coronavirus infections in IGAD member states and the looming threat of health crisis in the region. 3. Gravely concerned by the unsustainable and potentially counterproductive, uncoordinated global response and the unconnected country-specific measures to combat the COVID-19 pandemic. 4. Emphasizing the need for coordinated global and regional leadership and approaches to respond to the health and economic implications of the COVID-19 pandemic. 5. Recognizing the urgent need for a comprehensive, multi-sectoral, multi-agency strategy that addresses the impact of COVID-19 on all sectors, specifically health and the economy. 6. Acknowledging the central role and the proactive support of the African Union and its Center for Disease Control and Prevention, Africa CDC, through capacitation of healthcare providers and emergency response teams, as well as provision of medical supplies, including testing kits. 7. Further acknowledging the extraordinary sacrifices made by the healthcare delivery workers across the world and in the IGAD region to combat the COVID-19 pandemic. 8. Appreciating the swift actions taken by all the IGAD heads of state and government to contain and combat the spread of the coronavirus. 9. Recognizing the efforts and initiative of His Excellency Prime Minister Abdallah Hamdok to mobilize support from the international community to combat COVID-19 in IGAD region. 10. Supporting the efforts of Prime Minister of Federal Democratic Republic of Ethiopia, His Excellency Abiy Ahmed Ali. 12. Commending the extraordinary efforts of the World Health Organization to coordinate global and regional responses to the COVID-19 pandemic, including support to the international health systems of IGAD countries. 13. Appreciating the support from the international community towards preventing the spread of COVID-19 in Africa and strengthening the health systems on the continent and in the IGAD region. 14. Further appreciating the tremendous efforts of stakeholders that have ensured the continuity of supply chain and provision of critical and essential services for the population of the IGAD region. We are now here by solemnly resolve to: 1. Collectively formulate a comprehensive regional response strategy and an accompanying implementation plan to address the COVID-19 pandemic in the IGAD region that also incorporates the protection of populations and social groups that face difficulties accessing the national health system, such as IDPs, refugees, and migrants. 2. Establish an IGAD emergency fund for the control and prevention of pandemic diseases. 3. Expedite the adoption of a coordinated whole-of-government approach to responding to the COVID-19 pandemic in IGAD member states. 4. Strengthen the IGAD regional mechanism for responding to the outbreak and pandemic diseases through increased capacitation of the regional disease surveillance, early warning, and response system. 5. Mobilize medical professionals and support from IGAD community in diaspora to join the fight against COVID-19 pandemic in IGAD region. 6. Facilitate an enabling environment for strengthening regional public health systems in IGAD member states to deliver and respond to the COVID-19 pandemic. Roman 2. On support from the international community to IGAD. 1. Call upon international community to adopt globally coordinated and coherent approach to tackle this public health crisis. 2. Call upon international community to sufficiently empower and resource the World Health Organization to coordinate global response to all pandemics, including COVID-19, and directly assist governments in IGAD member states. 3. Call upon the international financial institution, bilateral, regional, and international partners, specifically WB, IMF, AFDB, to accelerate debt relief processes and provide access to financial assistance, concessionary loans, and essential support to IGAD member states and the Secretariat. 4. Reiterate the international community to support regional emergency fund for control of pandemic diseases and the strengthening of health systems in the region. 5. Appeal to the international financial institutions to urgently extend monetary and fiscal support in addition to exercising flexibility for IGAD member states to access finances needed to respond to the social and economic impact of COVID-19 pandemic. 6. Request international financial institutions to support the distressed private sector in IGAD region. 7. Urge medical professionals from IGAD community in diaspora to join the fight against COVID-19 pandemic in IGAD region. 8. Encourage the private sector to support the IGAD regional response to COVID-19. And we commit to remain actively seized of the matter.